Hi, you're listening to the Psychopharmacology Institute podcast. I'm your host, Dr. Wagdan Rashad, and this is a show that aims to help you, the mental health clinician, stay sharp on psychopharm. Today, our episode is focused on pharmacotherapy in autism spectrum disorders. Now, of course, it has to be said that medications are not the primary or the first option in the management of autism. There are behavioral and social interventions that are paramount in the management. These include applied behavioral analysis, ABA, and pivotal response treatment, PRT. But today, with Dr. Jim Phelps, we will review the results of a clinical study based in South Carolina that wanted to see what was better for irritability in autism, Aripiprazole or Risperidone. What has your experience been, if any? Dr. Jim Phelps explores his study with us in a quick take.
Next, let's look at a randomized trial for medication treatment in autism. The BAART trial, that's biomarkers in autism of aripiprazole and risperidone treatment. This was published in 2019 in the Journal of Pharmacotherapy. Before diving into these data on risperidone and aripiprazole, let's step back and look at the treatment of autism spectrum disorder overall. As you know, there are several targeted psychotherapies for ASD. Principal among them is ABA, that's Applied Behavior Analysis. According to a 2016 review of all treatments for autism spectrum disorder by Karen Wagner and her colleague Melissa De Filippis, there's also PRT, Pivotal Response Treatment. So those are the two main psychotherapies for autism spectrum ASD, PRT and ABA. Both of these are very behavioral approaches. Disappointingly, according to Dr. De Filippis and Dr. Wagner's review, it doesn't appear that there have been any head-to-head studies of these therapies versus pharmacotherapy, or even medication studies that used a psychotherapy control group. Instead, in their review, we find a remarkable list of medications that's been studied in randomized trials in ASD, including antipsychotics, antidepressants, mood stabilizers, stimulants, and 9 others in randomized trials, plus another 8 different medications or pills, add-ons, that have been studied as augmentation for risperidone. Interestingly, all but buspirone were actually superior to placebo as augmentation agents. So there's a huge range of medications that have been examined for various aspects of ASD. Here we're looking in this BAART trial at medication treatment of irritability. And this study compares the two main treatments that have emerged from all those randomized trials, namely risperidone and aripiprazole. It's also probably influenced by the fact that these are the two that have FDA indications where nothing else does. You recognize that that doesn't mean they're better. It just means that those are the ones that someone went to the trouble of getting an FDA indication for. So the question then is, where should one start if you're using a medication for irritability in ASD? The BAART trial looked not just at efficacy, but at a whole range of side effects to help facilitate making this choice. The subjects here were 6 to 15 years old, average around 8. And the results, the big news to my eye, is major weight gain. 26% of the aripiprazole group gained more than 7% of their body weight, 26%. And for risperidone, it was 70%. One of the reasons these numbers are so high is that participants were selected for having no previous exposure to weight-gaining medications like antipsychotics, so they didn't start from already having the metabolic problems. In addition, the authors found that prolactin increased from a mean of 9 before treatment to 40 on risperidone, with no increase in the aripiprazole group. So, with no major differences in efficacy, which was interesting, both of the treatments produced substantial improvements, steadily increasing during the 22 weeks under study. The other differences of note were sedation in 23% of the aripiprazole group versus only 7% for risperidone. Moreover, there were no differences in agitation or akathisia. So it makes you wonder, what doses were these kids getting? And the answer there, for aripiprazole, the starting dose was 2 milligrams. Roughly half the subjects ended up on 2 or 5 milligrams, and the other half on 10 milligrams. For risperidone, roughly a third were on a half or 1 milligram, a third on 1.5 milligrams, and the remaining third on 2 milligrams, with a few outliers at 2.5 and 3 milligrams. So the authors point out that 25% of the patients in the aripiprazole group and 33% of the patients in the risperidone group stuck with the lowest dose. In conclusion, for irritability in autism spectrum disorder, the authors don't emphasize choosing aripiprazole over risperidone, but given roughly equal efficacy and aripiprazole's lower incidence of major weight gain and lack of prolactin increases, it looks like a better starting place. Nevertheless, a comparison with a therapy like applied behavioral analysis would be really helpful.
Thanks for that, Jim. I have taken some notes and summarized them for you in the key points. Also, I want you to stay tuned for the next episode where we discuss a case sent in by one of our awesome listeners about an agitated young man with ASD. And we discuss treatment options. It's a discussion with lots of clinical psychopharm nuggets of gold. Stay tuned for that. But for now, listen up for the key points. Psychotherapeutic interventions for autism include applied behavior analysis, ABA, and pivotal response treatment, PRT. The FDA has approved the medications risperidone and aripiprazole for irritability associated with autism spectrum disorders. Risperidone and aripiprazole did not show a significant difference in efficacy. Weight gain and prolactin increase were much higher in risperidone compared to aripiprazole. Aripiprazole was more sedating than risperidone, 23% and 7% respectively. There were no differences in agitation or akathisia between the two agents. Do you want to hear more from Dr. Jim Phelps? He has regular audio updates on our platform called Quick Takes, where he discusses psychiatry research hot from the oven. Check it out on our website, visit piupdates.com and become a premium member already. We have a bunch of CMEs and essay credits for you to collect. If you're a Premium or Premium Plus member and you refer a friend to join our platform, you will receive a $50 Amazon gift card. You can also choose to join our newsletter to receive weekly updates delivered straight to your inbox. If you have a clinical case you'd like to share and hear it being discussed by experts on the podcast, email me your case at podcast@psychopharmacologyinstitute.com. Thank you. The following people participated in this episode: Dr. Flavio Guzman as a general editor, Andy Rode as audio engineer, Pamela Gonzalez as the project manager, and myself, Dr. Wagdan Rashad, as the host. We'd also like to thank Dr. Jim Phelps for being with us. Thank you for joining us in today's podcast. Until the next episode, goodbye.